Hello, today we'll be talking about infection prevention and control. Do you know that if you miss a chain of infection during the exam, you can lose a lot of mark, and in real life, you can lose a patient? So, what are the chains of infection? There are 6 links or 6 chain of infection, and they include: 1. The infectious agents themselves. The infectious agents that can be bacteria, can be fungi, can be protozoa, can be virus, etc. Then number 2 is the reservoir. When they say the reservoir, it means the person that harbors this infection, or the house of that infection, or the habitat of the infection. An example are human. Human can be a reservoir, animals can be a reservoir, soil can be a reservoir, water can also be a reservoir. Then the third chain is portal of exits. When they say portal of exit, it means the ways through which this infectious agent leaves the reservoir, and they can leave through coughing droplets. Coughing, they can leave through feces, they can leave through blood, they can leave through body fluid, etc. Then the next one is the mode of transmission. When they say mode of transmission, you're just talking about how this infection that you've coughed out enters into a new host. And they can enter through air droplets. Person inhales it, like COVID, inhalation. Can enter through air droplets. It can be direct contact. Direct contact, like sexually transmitted diseases, they are direct contact. Those are mode of transmission. It could also be through contaminated surfaces. When you touch those surfaces, then you take it in, either through broken skin and the rest. So those are modes of transmission. Then the 5th one is mode of entering. When they say mode of entry, it means how it enters its body. It enters through the nose, can enter through the mouth, can enter through broken skin. That's when there's injury. Can enter when there are injuries. Then the 6th chain of infection is susceptible hosts. In some places, they can just say hosts, while others can say susceptible hosts. And these are humans that are susceptible to infections, mostly those with weak immunity. And as a nurse, your job is to break this chain. And the most important way of breaking this chain is hand hygiene. Hand hygiene. Always wash your hand. Use hand sanitizer. And if you're in the hospital, please use your PPE, personal protective equipment, which includes your hand gloves, your face masks, and co. So follow us for more nursing and midwifery council exam questions. Thank you.